Hi, guys. It's Debbie, and I'm back again today to dive into data collection. I put together a few tools for you, and I want to work together on that example that I have for you in your web portal handouts under time management. And I hope that you've printed that out and we're ready to write together on this and work on it together. Now, yesterday I asked you, if you watched this video yesterday, I talked to you about choosing 4 patients on the next day that you see patients, and I want you to choose 4. I've chosen 4, and I'm going to walk you through what I chose for my 4 patients. So let me show you how I've mapped out data collection. Data collection should be, and this is just an estimate of time, it should be around 12 to 15 minutes. In the example that I created for myself, it goes 17 minutes. And I want to share how I map that out for you. So we're talking in this video about the blue area only, and then I'll do some other short trainings on treatment planning, patient care, and then the last part, the dismissal. Those trainings will be a lot deeper than what I have for you as far as video trainings in time management. So there will be separate video trainings that are much longer than what you're getting here in time management. So what I have done is written down my examples, and I didn't see any patients today, but if you did, let's say I had a prophy patient, what was the value that I added to that patient during their prophy appointment? And I think I've written a slide on that patient. I also saw a perio maintenance appointment, a gingivitis patient, and a new patient. My new patient had perio. And I think that this is a typical day in the life of a hygienist. You know, if you look at the CDC and the American Academy of Perio, their statistics, their data that they've collected shows that the average American 30 years of age or more, over 50% of those Americans 30 years of age or older have some level of gum disease, and it all starts with gingivitis. So ideally what you should see is, especially if you have 2 hygienists and you're each seeing 8 patients, there is going to be 1 gingivitis patient. And I'll do another training specifically on treating the gingivitis patient. And when you get your perio percentage up to at least 30% of your adult patients, you will start seeing perio maintenance patients every day. If you have 30 new patients as a goal for your dental practice, you're going to see a new patient, and many of those patients will be receiving a diagnosis of either gingivitis and many of them periodontitis. So let me see if I have the next slide here, if I remember correctly. Yes, this is my patient that I'm using as an example of 28-year-old male. No health concerns. There was nothing marked off on their health history. And I asked, any surgeries, any medications you're taking? They said no. The patient comes in every year, almost every 6 months. And today my patient, Bob is his name. This is all fictitious, but Bob it's been 9 months since I've seen him. So no contraindications. Now, when I took Bob's blood pressure, it was 150 over 90, and I was a little concerned. So I was talking to Bob about the mouth-body connection, and that inflammation in the mouth can contribute to high blood pressure, diabetes, Alzheimer's, other diseases, heart attack and stroke. Even though he's only 28, it's like a cascade effect. It's like a domino, like at the very beginning, everything's standing up, but you push one of them and it all starts to fall apart. So, he's starting out with a little bit of high blood pressure there. What's going on? He doesn't normally have high blood pressure when he comes to see me. So we talked about that, and I'm about 10 minutes into the appointment, so I take the bite wing x-rays. Now, bite wing x-rays, because it's digital, I can do this in like 3 minutes, and I have it all set up ready to go with my sensor. And so now I did some spot probing because 9 months ago, Bobby had a full mouth comprehensive of CPE and everything looked fine at that point. But today I noticed just a few areas of bleeding on probing. And I did mark those areas down when I opened up my exam on the practice management software, and I made note of that. So I am now about 15 minutes into my appointment. And in fact, what I'm going to do, because I visually examined Bobby's teeth and I noticed that he does not have any other restorative needs. Now, at this point, you could be using your Velscope or oral ID, or maybe you could have coordinated that with the last time Bobby was in and you did the perio exam. So you're going to coordinate these so that you're not doing them, you know, on this day. I don't want to do bite wings exam, oral ID, a smile evaluation, that's going to get me behind. So I didn't even write down that I did the oral ID because I'm already 15 minutes into that because I saw the bleeding points. So I actually, in my little microphone we have like an intercom system. I radio in that I need doctor to come do the exam. So I start my scaling of Bobby's teeth at about 20 minutes into that hygiene appointment. And doctor comes in. I'm going to actually walk you through in another video what happens during the doctor hygiene exam. So I want you to see that I ended up on a routine preventive care appointment being 20 minutes into that appointment before I started picking up any of my instruments to start scaling. So I also have written out for you, I mapped things out. And this is what I want you to do. If you're the only hygienist, I suggest that you map out your 4 patients of how much time you spent in these various areas. Let me show you what I've mapped out. So this is a time management form that I want you to print out and work on for all the 4 different types of patients that you're seeing. Prophy patient, perio maintenance, gingivitis, scale and root planing, new patient. Just play around with all of them. I just played around with this one and my team has actually finessed it and made it better and nicer for you guys. But you're going to bring your patient back and seat them. And I like to rapport build and catch up with the patients that I've known for many years, and just takes a few minutes. Kind of have to learn to know when to cut off the conversation. And in the state of Oregon, we are required to give our patients a brief synopsis of what they're in the schedule. What are they coming in for? And so I learned to teach that we need to tell our patients today what we're going to be doing is a preventive care appointment. I always say, and you'll hear, I think you've already heard me say this, nix the word cleaning. You're here for gum maintenance. You're here for gingivitis treatment. You're here today for gum therapy, or, as a new patient today, what we'll be doing is I'm going to take your blood pressure. I'm going to take a measurement of your gums to see if they're healthy. We're going to check for any abnormalities, and I'll do a training on oral cancer screening because I want to teach you to say we're going to check for any oral abnormalities. We can never tell our patients that they have oral cancer. And patients will say, oh no, I don't need that. Where in today's world of dentistry, I'm a huge advocate that you use oral ID or Velscope. The oral ID is my favorite, so I know a lot of our clients are also using Velscope, so I put that one down. But whatever that new technology is, you should be using that in your practice to find abnormalities rather than wait until we can see a lesion or feel it. Let them know doctor is going to be doing an exam, and let them know all the different things that you're going to be doing. It's amazing when I started sharing this with all of our clients, and I take a team approach, very holistic approach. So as a team, we're talking, and the dental assistant started telling the patients as they were seating and greeting the patient, today what you're here for is we're going to prepare this crown in the upper right. I heard the man say, oh no, I'm not here for that. It's amazing when the patients come in that they don't even realize why they're there. And today, before I started doing this, I have a old composite that needs to be, it was a sealant actually. They need to replace it with a composite. And I got an appointment text message to me today, and I'm thinking, okay, did I schedule for that composite, or is it time for my hygiene appointment? I honestly couldn't remember. So I think it's really important for us to let the patients know why are they there. Anyways, I digress. Then you're going to do the medical history review. On medical history, it's almost like we need to be a detective. And I started learning this many years ago when I asked, do you have you had any surgery since I last saw you? And it's amazing when you start asking that question that patients, all of a sudden, you're into the appointment, maybe 5 minutes after you ask this question, they're like, oh my gosh, I totally forgot I had, breast cancer and I had a mastectomy. Or one of my patients said, oh my gosh, I forgot I had throat cancer, and I had surgery on my throat. It's like, well, hello, this is a big deal here, but we have to be the detective. You're asking, are you taking any blood thinners? Because that's going to affect what you're doing as a hygienist. It's going to affect the dental assistants and the doctor when they're preparing a crown or, doing some restorative treatment. We have to ask these questions. Are you taking aspirin? Do you take any supplements, any herbs? Did you know that ginkgo biloba, that, and I think it's St. John's wort, they can cause bleeding in the gums a lot more easily. Same with aspirin. We need to know these things, and patients forget to tell us. So we have to go, like probing, like they're the aliens. All aliens are the only ones probed, because when you're telling your patient that you're going to do the comprehensive perio evaluation, the CPE, or even when you're telling them you're going to spot probe, you do not tell them that you're going to probe. I was actually with a client last year, and she said, I'm going to probe, and now it's going to poke you a little bit. I was like, okay, well, that just set the patient up for some pain. And I want you to know that we do not probe our patients. We probe aliens. And we're kind of probing our patients who may feel like aliens when we're asking all these questions during the medical history review. So let's tell our patients that I'm going to use this ruler, and I'm going to check for the health of your gums, if there's any inflammation or infection. I want you to write that down. I'm going to use a ruler to check the health of your gums. I'll take a deeper dive into this area of comprehensive perio exam at another time, but I wanted to mention, let your patients know you're going to be using a ruler to check the health of their gums. Now, at this point in time, your patient does not have a bib on, but you've done the greeting, the seating, review of medical history, or maybe 10 minutes into the patient appointment. You should, if you're going to take x-rays, have that all ready to go. The sensor's there. You're not running out of your room to get it. If you have an assistant, they shouldn't be running to go get that. You don't need to radio them. It's all there, ready to go. And your digital x-rays are ready to go on the patient's chart on your computer. This should not take more than 5 minutes. Even if you're doing 4 bite wings and 2 PAs, it does not take long. I have actually timed, and I do this, I time the assistants when I'm in office consulting, I time the doctor, I time the hygienist, and I'm telling you, for a full mouth series, I see hygienists doing full mouth series of x-rays under 10 minutes. Super easy with digital x-rays these days. So at this point in time, we've taken the x-rays, and at the most, we're 17 minutes into this. Now, I'm going to use my probe. I'm going to use my ruler, and I'm going to do a visual exam at the same time. So honestly, if you're just spot probing using your ruler and just checking a few of the teeth, you will notice it doesn't even take more than 2 minutes. But I'm actually erring on the longer side for time, just to help you out and give an example that shows you it doesn't really take this much time if we get it down to a science with what we're doing. So at this point, I took my x-rays. I haven't spot probed yet. I've done, 5, 10, 15 minutes into it. So now I put the bib on Bob, my patient. Remember, he's the patient that is it's been 9 months since the last time I saw him. So I put him back in the chair, and I tell him, now, Bob, I'm going to use my ruler. and I'm just going to look around real quickly. And I'm also going to use this other instrument just to make sure you don't have any new cavities. Just want to look around for any abnormalities. Now, we did the oral ID last time he was there in the office. So I use my spot probe and I use my ruler, excuse me. I see that he's got a few areas of inflammation. Oh my gosh, this kind of goes hand in hand with, remember I told you he has slightly high blood pressure today. And so that took me another 2 minutes. So let's see, I'm 5, 10, 15, 19 minutes into that. Now, because I saw something that was a little off, it's not normal for Bob to have inflammation in his mouth. He's always been coming in every 6 months routinely. But today, I'm going to sit him up. And I'm going to spend maybe another 5 minutes. So we're 5, 10, 15, 17. We're about 17 to 20 minutes into this. And now I'm going to spend another 5 minutes maybe. And I want to show Bob where there's inflammation. During my exam, I took out my intraoral camera and took a picture. And so at this point in time, my data collection, let's just stop it at data collection, which was up to my exam, okay? So at this point in time, I've got 5, 10, 15, 16, 17, 18, 19 minutes, and I'm erring on the longer side for everything. 19 minutes, and I want to sit him up and talk about treatment planning. So let me use Bob as an example of the treatment planning, and I'll be right back for another video. I want you to make sure that you download and print out the time management formula example. I want you guys to fill this out. I want you to write down how much time it takes you, all the different things that you do in a preventive care, your prophy appointment, your gingivitis patient, your new patient, your scaling and root planing patient, and your para maintenance patient. I want you to map out those different types of patients so that you can get this time management down to a science. This will help you to save time. You will have a Zen day, not a migraine headache at the end of your day. And I know for sure it will keep you on your schedule and not feeling like you're on roller skates. So I'll see you on the next video. Bye for now.